Integrative Medicine, and I'm joined by Dr. Michelle Dilks. And Dr. Integrative Medicine, maybe a new term for a lot of folks. Tell us what it's all about.
Integrative medicine, the easiest way to describe it would be a blending of conventional medicine and alternative medicine. So it was basically created by Dr. Andrew Weil, who was my mentor at the University of Arizona, is where he has his fellowship now. And he's been working on this his whole career, but the last 20 years or so, I would say it's been becoming much more popular. He's actually training board-certified physicians who are trained in what you see, on an everyday basis at the hospital or the office, and teaching them the things that we don't learn in med school. Nutrition, which,
Right.
We don't learn a whole lot about nutrition in med school. Herbal supplements, mind-body therapies, a lot of different things that you might go to the chiropractor for, or the naturopath, or many different other, alternative practitioners you can now get with a board-certified physician as well, so that you can get the full entire treatment in one place.
And you're treating not so much symptoms, it's treating the overall person.
Right, exactly. And medicine has gone, on the way of the pharmaceutical companies and the insurance companies trying to get at how can we make this as short of a time as possible, make as much money in a short period of time, and just give a pill and be gone with it. Whereas in integrative medicine, we see treating the entire patient and
Right.
trying to get at the functional cause of the actual problem and fixing the entire part of what's wrong with the patient, instead of just giving them a pill to make them feel better for a short time, and then
Right.
they're going to end up coming back and feeling bad again.
No Band-Aid solutions.
Right.
Wanting to be less invasive and be more natural about things.
Absolutely, absolutely. So, and we use all the conventional medicine treatments that you would be used to, but we try to limit how much intervention we do. We try to stick with the simplest, easiest route first, and then we'll kind of build on that. And if we need to get to powerful prescriptions or surgeries or
Right.
invasive things, we'll get there, but we try to keep it less so first.
Right. And you utilize great lab work. If you need lab work done, you take care of those situations as well.
Absolutely. There's a lot of different specialized lab testing that is becoming more popular: genetics testing, hormone testing, looking at nutrition profiles to see what we may be deficient in, even checking for environmental toxins and things that we are exposed to in the environment. So I can utilize those tests that you may not typically see, your general physician order, and then we can get a little bit more specialized into what specifically are you missing and what do you need to supplement with.
Right. And you also spend a lot of time with your patients.
Absolutely.
Talking with them, delving into
Right.
their problems. And that's one thing that kind of sets you apart. I know a lot of times doctors don't have a whole lot of time, but you want to spend as much time as possible with your patients, correct?
Right. The insurance companies, unfortunately, have kind of pigeonholed us into limiting our time and spending 10, 15 minutes with each person. But I spend up to 2 hours with a new patient and up to
Wow.
1 hour with a follow-up patient. And I also use hands-on techniques with osteopathic manipulation and try to get treatment, from head to toe, full mind, body, and physical treatment for a patient.
And talk to us about some of your background, some of your training. You have some very specialized training when it comes to integrative medicine.
Right. I went to medical school at Philadelphia College of Osteopathic Medicine, graduated, and then has practiced family medicine for over a decade.
Right.
And then went to the University of Arizona under Dr. Andrew Weil and studied a fellowship in integrative medicine. I spent 2 years doing that, and it's an in-depth training in order to learn all these different things, like I said, that we didn't learn in conventional medical school.
You've been here at this office, at this location since January.
Yeah,
a
just
fairly new office and situation for you here. How are things going? How have you been received so far?
So far, it's just new. Everybody's like,
Right.
what is that,
Yeah.
And so I've been getting a lot are phone calls, and, I was in the newspaper, and they did a really nice article, too. So it's just getting the word out
Right.
of what is integrative medicine, and, what are you going to offer different for me, so.
And what is the one message? I can't leave here today without you getting that one message that you want to get to those potential patients that may come to see you.
I would say, that I feel like that I'm going to offer you a lot more complete whole body treatment and whole mind treatment, and try to get you feeling better and back to yourself 100%, rather than just, kind of band-aiding something and sending you on your way. We're going to make a partnership, and we're going to work on this together, and we're going to get you to feeling like you want to.
All right. Dr. Dilks, thank you so much for having us
Thank
in
you for
today.
coming.
It is Greeneville Integrative Medicine here on Hannah Street in Greeneville, Tennessee.